afternoon. Thank you for attending the Pain Management on Organic Dairy Farms, presented by Dr. Ulrike Sorge, Assistant Professor, Dairy Production Medicine, University of Minnesota, and Dr. Gustavo Schuenemann, Associate Professor, Extension Veterinarian, The Ohio State University. My name is Eric Pulaski. I am the Sustainable Agriculture Educator with the Ohio Ecological Food and Farm Association, and I will moderate this afternoon's presentation. This event is part of a series of educational programs offered by OFA and OSU Veterinary Extension to practicing veterinarians, farmers, and animal health professionals who work with certified organic livestock. OFA was founded in 1979 and is a grassroots coalition of farmers, backyard gardeners, consumers, retailers, educators, researchers, and others. For more than 35 years, OFA has used education, advocacy, and grassroots organizing to promote local and organic food systems. We are also one of the country's largest and oldest accredited organic certification agencies, certifying a diversity of operations throughout the Midwest. More information about OFA is available on the web, www.oeffa.org. With an office in every county and celebrating its 101st year, OSU Extension is the official outreach program of The Ohio State University's College of Food, Agriculture, and Environmental Sciences, with additional faculty and staff in the College of Education, Human Ecology, and the College of Veterinary Medicine. The core of OSU's Extension focuses on 4 areas: enhancing agriculture and the environment, strengthening families and communities, advancing employment and income opportunities, and preparing youth for success. Partial funding for this webinar is provided through a grant from the North Central Region Sustainable Agriculture Research and Education Program. NCR-SARE has awarded more than $40 million worth of competitive grants to farmers, ranchers, researchers, educators, public and private institutions, nonprofit groups, and others exploring sustainable agriculture in 12 states. We thank SARE for this support. The questions this afternoon will be moderated. If you have a question, please type it into the question box on your screen. We will have time for questions at the end of the presentation. Please feel free to submit questions or points of clarification as they come to mind. The presenters will monitor these questions and may address them during the presentation. Otherwise, questions will be held until the designated question period. OFA is pleased and fortunate to introduce Drs. Sorge and Schuenemann as our presenters. They each have direct experience in clinical, production, and research aspects of the dairy industry, and we hope this presentation can enhance the triple bottom line of your organic dairy operation. Without further ado, Dr. Sorge.
Thank you very much. Hello, everybody, and welcome to this webinar on pain management on organic dairy farms. And here we go. And so just to give an overview over the webinar. So first of all, obviously, we have to clarify what we're talking about. And then I will talk about how to recognize animal pain. And I will focus on dairy cattle because that's what I'm most familiar with and I have the best examples for. I will go about which painful procedures we have to be mindful about and how we can actually manage the pain of animals on farms and which substances are allowed under the NOP and what that does to the bottom line. So when we're talking about pain and taking care of animals, we really, all of us, have in mind the animal welfare. We want to make sure that animals are well taken care of. And in the recent years, in particular, the consumers are very much focusing on animal welfare, and they have in mind animal well-being. And a large part of this is that they're very concerned about things that they might perceive as very painful, and also how we are handling pain on the dairy farms. And so I think, we're all on the same page in that regard because I think you will agree with me that the farmers are the caretakers of their animals and obviously want to make sure that they're well taken care of. And so pain doesn't necessarily fit into this. The actual definition from the International Association for the Study of Pain is that pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in such terms of such damage. And so you can see that there are two things that go into pain. number one is sensory, so just the feel for it, and then number two is that there's an emotional experience involved with pain. And so this is obviously something that might be a little bit more difficult to experience from an outside person. And so particularly for assessing pain in animals, this might be a little bit more tricky. But when we're looking at what happens both in the human as well as in our farm animals in regards to pain, then we can see that there are two kinds of pain. One is the acute pain, and the other one would be the persistent or chronic pain. And pain doesn't necessarily have to be something bad. Well, first of all, in acute pain, the body is reacting to a noxious or harmful insult and reacts with setting up chemicals and so forth. You know, that's kind of basically the physiology that happens there to notify the body that something happened to it. And so the nerves then start firing up and sending the information to the brain. And ultimately, the whole point of acute or feeling pain is for the animal to have a chance to get out of that situation, and so the reflexes are coming into play, and so the animal is immediately instigating a protective behavior by removing the foot, for example, or trying to move away from the pain. And so if we're looking at this in this little diagram, then you can see that at the left hind foot of the animal will receive the pain. It goes back into the spine of the animal, and it also has an immediate feedback, so that the pain doesn't have to register or has to be perceived in the brain yet, but that the foot can immediately be removed, and that's kind of how a reflex works. But then also, again, the animal perceives the pain and can learn from it and can change its behavior based on this one. So if we're looking at acute pain, there are multiple things are happening. Obviously, you have the instance that leads to pain, and there are different things happening, and I'm mentioning this because that is what we need to know as a background information for selecting appropriate medication later on. But basically what happens is the cells are releasing information to the surrounding tissue saying, hey, we are damaged here, and then the nerves are the little highways transmitting it to the brain. So while the acute pain and the reaction to it might be good, because that's basically what evolution told or was advantageous for us in evolution, because it improved our survival chances to get out of the tricky situation. Prolonged pain or chronic pain is not so good. So if you have, if the pain persists, what this leads to is hypersensitivity, hyperalgesia, and allodynia. And so the hypersensitivity is basically that the animals, or it applies to us too, is if we are persistently having pain, then the threshold is going higher for the reaction to pain, and we are even more sensitive to pain and more likely to react to pain. And so hyperalgesia kind of follows this a little bit, and that means that the increased pain from a painful stimulus. So even though we're expected to have a certain amount of pain with a certain injury, let's say a cut, it actually increases it again to make the animal even more aware of it. And then with this, we all probably know about it, the technical term for it is allodynia, and that is pain from a non-painful stimulus. So if we are having, let's say, a burn or something, then that area might be painful, and just by gently touching it, which usually, if it wouldn't be painful in that spot or burn, wouldn't cause any pain, but now it actually leads to pain. So all of this is part of chronic pain, and there's really no positive outcome. I mean, you can't really escape this prolonged pain. It is something that's also called true as maladaptive pain from, for example, cattle who are lame. And so we don't want to have chronic pain in animals, because prolonged or chronic pain in animals really leads to, again, conscious endurance of the pain and or the stress. So a stress situation, and the animal just has to get somehow survive this. And so it can be both, and therefore physiological as well as psychological. And suffering is then also leading in the long term to really distress, which is really the state in which an animal cannot escape from or adapt to the internal or external stressors or conditions it experiences in a negative effect on its well-being. And so suffering and distress, I think, you will agree with me, are having no part in animal welfare, because the animal is basically trapped and can't do anything about it, and its well-being is no longer taken care of, and the animal is under stress. And that's what all these bold words are meant about. And so we have to recognize when an animal is in stress or potentially distress, and when an animal has pain, so that it never even gets, hopefully, to the point of distress. And so with cattle, what we have to be mindful about is that cattle are a prey species. So they will not advertise if they are in pain, because evolutionarily this is a disadvantage for cows. Obviously, if you have the neon signs saying that you are injured, that shows weakness, and the lion might come and eat you. So obviously cows prefer not to show any pain behavior, and so it is overtly, and so it is on us to recognize when an animal is in pain. Because it is not advantageous for a cow to advertise she's in pain, vocalization is not a reliable pain indicator or detector. I mean, if you're knowing from a dog, it might be yelping and it's hurt. For a cow, it's not good. And so we can use, the vocalization as detection. If you're looking at these procedures like branding, castration, or even disbudding, very few animals actually vocalized during this time, even though they're considered painful procedures. So instead, we have to look at the cattle behavior, look at her posture, look at her facial expressions. This is something that quite commonly is used in the human medicine, in particular in coma patients, because again, although those people cannot verbalize if they have a problem, there is unfortunately no real good scale for animals in regards to, let's say, facial recognition of pain, but we have to look at the animal and recognize if a problem is occurring. So this cow, for example, has, again, her entire posture with a long stretched neck and her entire experience. You can see at her eyes and her facial, she is rather dull and depressed. Look at her ears; they are rather down. So no perky 10 and 2 10 a.m. and 2 p.m. Position of the eggs of the ears, and you can see in her rumen that she really didn't feel like eating, and so she has a decreased feed intake. And in the longer term, again, you can see that it leads obviously to weight loss. And as you can imagine, this will lead to not only weight loss, but also loss in milk production, and again, well-being as well. And so if we're looking at also this cow, unfortunately there's no sound to it, but again, if you're looking at this cow, you can see that she is breathing heavily. She very likely also has a speed up heart rate, and also you can see that she's pressing her head here, and she's not really willing to move. Again, this cow is calm, quiet, but again, in pain. If we're looking at this girl, again, another pain behavior typical in cows is, again, the reluctance to move, just like the other girl, but she also looks at the stimulus of, with her ear. She's pointing towards the ear, and she's not necessarily pointing at me with this. And you can see that she is also moving or trying to kick her belly, but again, she's very reluctant to move, so it's not a full-blown kick towards the belly. There you go. And so, ear flicking, this slight kicking, this colicky behavior. I mean, she's obviously having a bloat, but again, it's not very strong behavior. So if you're looking at cattle behavior and when they have pain, yes, you can see that restlessness and pacing. Again, with acute, in particular with acute pain, it's this escape behavior. They want to get away from what is causing the pain. If you're looking at horned calves with the persistent pain after dehorning or disbudding, you very often see an ear or tail flicking or head shakes. The stomping and kicking we've talked about. And then you also see very often licking or even biting of sides. I mean, I've even seen a cow that bit off her, all of her teeth because she had mastitis, so it can go to some extreme cases. Again, this girl here on the left, she is very quiet, but again, a clear sign of pain is the head pressing. And then again, with avoidance behavior is also limping and not putting weight on it. This girl also was in pain. She had a broken leg, and so obviously if you're not knowing about the broken leg, you might think rabies, but again, you see how quiet she is, and she's actually just chewing emptily as a displacement activity to cope with the pain. You can see her stare and how much she's looking, and so these are typical pain behaviors in cattle as well. But you don't necessarily have to see, the stare, the face of the cows and so forth. If you're looking at this girl here on the right, this is a lame cow, and she's wonderfully clean, so she hasn't gone down or anything like this. But what you can see is the arched back and also kind of how she is tucking in her belly, again, just trying to cope with the pain in her left hind foot, but she's not putting enough weight on. And so, in particular, pain with lameness associated is a very common occurrence on dairy farms, and yet we sometimes overlook it because maybe it's fairly common, maybe sometimes it's very subtle. So if we're looking at this one, this is a chart from Zinpro. The scale goes from 1 to 5. And so the non-lame cows are the cows with a score of 1 and 2. And so if you're looking at a cow, preferably done after milking on a flat surface, hard surface, to recognize what's going on, then you want to look at arches. A cow, and I have a video in a moment, naturally has a very fluid movement, yet her back is flat and a straight line. As soon as a cow starts to show an arch, she again shows avoidance behavior and tries to put pressure off it. And so if we're looking at cows when they're moving, then you can see with this cow, she is putting weight on all of her 4 legs, and this multiple videos. And you can see how actually pretty straight her back is. It's not moving very much. And what you will also see is that her hind feet are overstepping, or the front feet were stepping. So this is really what we should be able to see with a normal, smooth walking cow. If we, on the other hand, look at the next cow, again, even pacing of the different ones. There's no difference in the footing and very fluid movement of the cow. With this cow, you see she lost a little bit of the fluidity of this previous cow. in her movement. And what you also can see is she has an arch. And so right above where her hip is, she is arching it, and there is a slight ataxia to her top. And you can see that her hind feet are not overstepping where her front feet were either. So it's really that this cow has a minor lameness, and we should have a look and figure out where exactly it's coming out, where it comes from, so that we can take care of the cows early on to identify where her problems are. And we don't necessarily do this, because the problem is if animals have chronic pain, they will try to avoid putting pressure on it. So this particular sheep had problems with the front feet, and so avoided at all costs to step on it. And so this is, the knuckling is a very common thing to see in sheep when they're lame. And so as you can see in these pictures, it has been going on for some time, and should not have gone on that long. So I think we recognize that animals feel pain, and yet it is very difficult to really understand the complexity of pain in animals, because again, we can't add to the emotional status, for example, of the pain definition, but we can see based on some of the behavior that things are painful to animals. The problem with that one, yet again, is that there are individual differences. In particular, cows, some are more stoic than other ones, and so it might be, not as easy to differentiate, or we can put a scale on how much pain an animal is feeling, because cow A might be behaving differently than the other one. And yeah, they can't just tell us necessarily how much pain they're in. And so, but I think if you're looking at these different charts from the literature, then you can see that if we're comparing the responses from producers as well as from veterinarians about, what is the perception of pain of animals, how painful is a certain condition or procedure in animals, then you can see here in these charts, the light gray are the producer answers, and the darker gray ones are the veterinarians. And on a scale from 1, which is absolutely not painful, to 10, excruciating pain, then you can see in the majority of cases, minus this eye disease on the top left here, there's a very good agreement between veterinarians and producers in regards to what is the painful condition. So, for example, if we are looking here at an E. coli mastitis, so blue bag, then we can pretty much agree that we all agree that this is a very, very painful condition in animals versus the subacute mastitis, which maybe just shows adulteration in milk, has a little bit lower level of pain. But if we are looking at this, the question is, how often do we use pain medication or anything for animals with mastitis or E. coli mastitis? And so another thing, it's not only the diseases that might be painful, but also the procedures. And so if we're looking at this, and this is from a different paper, where he was asking veterinarians in regards to how much pain do you think is associated with these two procedures. One is disbudding in baby calves, and then the other one is dehorning in mature cows. And again, they're pretty much identical in the pain scale for that was assumed from the people in this one. So in all cases, we have at least, or the most common one is at least an 8 of the pain scale. Yet we are very rarely using local anesthesia while dehorning, even though we know up front that this is a painful experience. And if we're looking at the different programs, like farm programs and so forth, they actually recommend to use local anesthesia or analgesia. And so even, and especially also if we're looking at our own National Organics program and the paragraph in regards to livestock healthcare practices, then it is very clear that we have to give provisions of the conditions which allow for the exercise, freedom of movement, and reduction of stress appropriate to the species. And again, pain is associated with a lot of stress, so we have to make sure that we reduce the stress. And then we have to make sure, and you mentioned specifically pain, that the performance of physical alterations is needed to promote the animal's welfare in a manner that minimizes pain and stress. And so we have to, whatever we do, we have to minimize pain and stress in the animals, and we have to make sure that anything that we are using are adequate and have to be within the framework of the NOP, but also in the framework of the FDA. So this is really a crucial thing that we have to be mindful about, because we have to have the two regulations, which are not necessarily disagreeing, actually they should be pretty much overlapping. And again, for veterinarians, it's a very important thing to, that's what they have to think about is, okay, the FDA. And then in addition to this one, obviously, like always, we have to be mindful about the fact that we cannot withhold the medical treatment from an animal just to maintain its organic status. We have to give it appropriate pain medication to make sure that things like the animal welfare is taken care of. And so when we're working with animal welfare, or sorry, with animal pain management on farms, then we really should think about those three things. And I think the 3S approach that was mentioned by Gustavo et al. In 2010, and I think that fits very well with, again, the organic spirit, that we have to suppress, first of all, anything that could lead to pain in the first place. We can't suppress it. We need to substitute it with something that is less painful. And if that even doesn't work, we have to find a way to soothe the pain of the animal, and that includes the appropriate use of pain medication in the animals. And so, for example, a classical example for suppress the likelihood of pain would be, for example, to use pulse genetics in cattle to decrease the need for dehorning, so then we don't even need to do this procedure. Or instead of dehorn a mature cow, we use this budding early on, where the horn is not attached to the skull yet and is still part only of the skin. But if we are looking at the pain medication, then again, it comes back to that we must not administer animal drugs in violation of the FDA. And the thing is that because it is so difficult to quantify pain, there's actually no FDA-approved medication specific for pain medication on the market for livestock. And so because of this conundrum, we have to work within the framework of MJICA, or the Animal Medical Drug Use Clarification Act, which allows for the use of drugs extra label. But there are some things that we definitely have to be mindful about to stick or to not violate any of the FDA regulations. And so because any drug that we use for pain medication will be extra label drug use, and therefore the mandatory things that go hand in hand with extra label drug use are that it has to be overseen by a veterinarian, or can only be applied by a veterinarian directly. And if there's veterinary oversight, there has to be an established veterinary client-patient relationship, and that is an absolute prerequisite for this. And the drugs that are used can only be approved animal or human drugs. So in addition to this one, it can only be used for therapy and not, as a feed additive or just plainly for production use. And we have to make sure that if we use something as an extra label drug, then we have to make sure that we have the data to be even able to use it, so that we avoid residues in feed of, in the food products derived from those animals. And so we're looking at the list of allowable substances under the NOP. All of them are ELDU. So for the pain medication, if we really call it for pain medication. Aspirin is actually not even FDA approved, just was grandfathered in. And a lot of people have been using it, and I'm not sure if you're aware of it. There is this organization or this website called FARAD, F-A-R-A-D, and that one is for the Food and Animal Drug Residue Avoidance Data Bank. And so they are suggesting a withhold time for milk and for meat of 24 hours. It's not necessarily specified in the NOP, but we have to be mindful about it. Lidocaine, again, all of these are prescription drugs. Lidocaine is very commonly used as a local anesthetic. Very long meat withhold time in comparison to conventional forming or FARAD. And but again, it should be used as a local anesthetic. Flunixin is a very good anti-inflammatory drug, which has much better qualities than aspirin. Aspirin has only about a half-life of about 30 minutes. Flunixin at least lasts for a few hours, and so we have to be mindful about when we're using this. The other thing is Flunixin is actually the only one that is licensed for the use in livestock, and you can see here an indication that there are certain things that it is allowed for. And so the important thing here is that you have to give it IV. If you don't give it IV but IM, this is what happens. So here on the left side you can see from just a little injection with Flunixin IM, even 7 days later there's massive scarring in the tissue of bovines, and if you would do this to a horse, this flesh-eating wound would be the result of it. So do not use it extra label. You're doing more harm than good. And again, if you're changing the route of administration, that is again another form of extra label drug use, which has to be overseen by a veterinarian if there is something like this, again, to avoid having these awful things happen to the animals. The other allowable substances under the NOP are xylazine, and xylazine is a good sedative. It has slight analgesic qualities as well, but the odd thing is that in the NOP it specifically states that it can only be used in an emergency. So if you want to give baby calves xylazine and lidocaine during decorning, you might have a problem because this is not considered an emergency. It is a routine decorning as well. And then if you're going back up to the second from the top, butorphanol is an opioid, which again has a very good sedative indication. And but again, if you're looking at all of those different drugs that are allowed under NOP, you can see that there's a lot of variation in the withhold times. This sometimes, like Flunixin, twice the withhold time from FARAD, and other times the numbers are not necessarily based on science, more based on an indication that was given from FARAD. So I think we have to be mindful when we're using this that we have to look into the NOP to make sure that we keep the withhold times for organic production, and otherwise you might have to sell the animal just for beef. You can use it, but if the animal has to go to slaughter, the animal just would have to go for conventional beef. So if we're looking at, actually one of the things that I might add on this one as well, the thing that you see is that I did not add any acupuncture points or homeopathy to this. And quite frankly, I was going through literature and I could not find any convincing studies that would support acupuncture. It might work, it might not work. But again, the studies that are out there do not, unfortunately, at this point, show strong evidence for the use of acupuncture. Most of the studies that I could find were either having no control groups or had too few animals to statistically be meaningful. And again, homeopathy, again, had pretty much the same problems. In addition, there are no approved drugs for homeopathy that you might be mindful about if you're using this under NOP or Mduca. And so when we're thinking about the common sources of pain on farms, then again, the most classical ones are the spotting and castration, surgery, and then in mature cows, the dehorning. And then in the diseases, like I mentioned earlier, we have the most common ones would be lameness and mastitis, abdominal disorders like displaced abomasum, and obviously dystocia as well. It's considered painful. And so, again, thinking about the 3S approach of how to deal with this, then we should work with the spotting rather than the dehorning, again, just simply because at that time it is not as massive of a surgical procedure as it is for mature cows. Do it early on, about 2 to 3 weeks of age. At that point, they're above, beyond the hump of high risk for diarrhea. And again, please use local anesthetic, analgesic, just so that the animals are taken care of. And again, I mentioned this earlier, herbal homeopathy also don't have any data at this point to show efficacy over the whole time. So I would be very careful to use them, because you want to use them for their efficacy, and if you don't have any data on it, you can't really win this argument. And so it's very easy to set a local nerve block in a calf. It's just getting the coronal nerve block. You set a few cc's of lidocaine there. Again, talk to your veterinarian about the best approach to this, and give the calves a chance not to feel it. And just to kind of show you, this is what it feels like when a calf is dehorned without local pain medication. Again, see the pain behavior, tries to escape, tries to get out of there. Massive struggle. Versus looking at this, where the calf has had its local anesthesia. And so it's not that expensive to use local anesthesia like lidocaine, and I think everybody has a better time going through this unfavored procedure compared to not using local analgesia. With castration, I think this little sentence sums it up. The older the animal gets, the more it grows attached to its testicles. So again, do it as early as possible, because again, the vascularization and so forth is going to obviously be growing as well. And please use pain medication. There's clear indication that using epidural, for example, and also in combination with systemic NSAIDs like flunixin, that it actually improves the welfare of the baby calves for a longer time compared to not. So, yeah. And then the other thing, again, just going through common procedures, we should use local blocks for any corrections on the foot of the cow, because they can be painful, and this is much more pleasant for the cows and as well as the people involved. Pick them up early, make sure that it doesn't become chronic pain. Use NSAIDs, and it's very simple to use a local block. You can use it in the tourniquet, you can use it IV, or you can just set it over the nerves as well. So again, talk to your veterinarian to learn about the exact techniques, but it's all doable. If we're looking at mastitis, there is some indication that the provision of NSAIDs is actually advantageous to reduce the swelling in the udders, and then also with dystocia, after cows experience dystocia, don't forget to give them some NSAIDs, because again, that increases or decreases the swelling, and there has been some indication that they are better getting back up on their feet compared to not having any little help. And that brings me to my last point, and that's the economics of pain relief. The funny thing is that there are very few meaningful studies. Newton and O'Connor have done a fairly recent literature review, going through different studies, looking at the economics of it. And most of the studies that they could find were only looking at the pain response for a day. And so obviously that's not enough to really follow up and figure out what was happening to the animal and to the average daily gain. But what we for 100% can say is that we see in the vast majority of cases a reduced stress response, especially adrenergic stress response, and that leads to less immunocompromised animals. There are some indications that if you are giving local anesthesia, or analgesia, to baby calves at both dehorning and or castration, that there is better average daily gains. And Leslie and Peterson Wolf, they were finding that given NSAIDs to cows with mastitis, certain cases of mastitis, they actually saw an improved dry matter intake of those animals and also an improved milk yield in the long run. But yeah, again, funny enough, it's not that there are not that many studies actually looking at the exact numbers for how much it costs and how much it improves it. But I think if we're looking at it, it's not that expensive to give a dose of most therapies to the animal, and reduces the stress, and that's something that we definitely want to do for the pain and animal welfare. So just to take it up, to wrap it up, so in case, so number one, I think we can all agree that cattle feel pain, but they will be much less obvious to show it. It's really crucial from our side that we have pain prevention and mitigation strategies as part of our taking care of the animals, so that we can ensure animal welfare. And that if we are using pain medication, we need veterinary oversight, just so that we stick to the regulations of the NOP and FDA. And just using pain medication is really a piece of the organic philosophy overall. And so with this one, I hand it over either to questions now or to Eric.
Yeah, I haven't heard any questions yet.
Okay. I mean, let's collect them maybe for later. I mean, that was a bit of a whirlwind, I guess. So we can wait till the end for questions, because Gustavo's going to go next too.
Yeah, no questions have come across the screen yet, so I'll go ahead and, well, wait a minute, here's one. You advocate giving NSAIDs for dystocia. There have been a couple of studies showing that the administration of Banamine increases the risk of retained fetal membranes, mostly due to the blockage of inflammatory COX-1 and 2, if I'm remembering correctly. How do you balance the potential good effects of giving NSAIDs post-dystocia with the potential of increasing the likelihood of causing more pain with a retained fetal membrane?
Yeah, and I'm aware of it, of those studies, and again, it has to do a little with the timing as well. I would look at the animal and would make sure that the animal is taken care of. The studies that I've seen, they have shown a reduced likelihood of metritis, actually, oddly enough, despite the other studies showing the increase in retained fetal membranes, and that they also saw that the animals were eating more at the end of it. And so that, again, they found that it was off-balancing to the negative energy balance at the early lactation again, and they found that the long-term was actually not as bad as you might think. So again, I think, again, talk to your veterinarian as well, and come up with the best strategy for your farm to make sure that you have a good protocol in place as well. And again, use data to make the best decisions.
All right, thank you. Now we'll turn it over to Dr. Schuenemann. Dr. Gustavo, do you have your microphone muted?
So, I'm not sure if you can see me now, Eric.
Yes, you're coming through. Thank you.
Okay. So, anyway, well, thanks, Eric. And this is it's actually a case study, very practical information on putting the presentation on pain management at a cow level, or if you will, at a farm level. And I picked one specific condition, and then we will talk about mastitis, specific for those severe cases of mastitis that we might require to have some pain management there for these cows. So, something I guess is important on mastitis. You know, you're going to have some of these, you know, small farms, and then the cows are really well taken care of. And so how we do this, and usually you're going to identify those, you know, mastitis, which is an inflammation of the mammary tissue, mammary gland, and how we identify those severe cases. And usually this is going to happen, you know, on milking times, and most of these farm perhaps milk cows twice a day. So every 12 hours, you know, personnel are going to see these cows and check whether or not they have developed mastitis. So I'll talk about this, and I put some kind of practical information there on how we go with these conditions. I think that the most important aspect, and this is applied for pain management as well as other conditions, is to establish a protocol of what other people call SOPs, you know, standard operating procedures. And I think it is extremely important we develop this protocol, and the veterinarians are involved in the step of putting together the protocol at the farm level, right? Once you establish the SOP, so then people know what to do. They do have the knowledge and the skills needed to implement this protocol. And I think there are two questions there. Once you have a protocol established, what we do with that protocol, and usually the what, you know, what we do with this is just answer the question regarding, you know, we know the dose, we know the drugs that we are going to use specifically for pain management. Then the question is, like Dr. Sorge mentioned during her presentation, how do we know that these are the animals? So who is going to get this protocol? I think it's, you know, we know how to put this protocol, and then it became, you know, for us a challenge in a way to say, these are the cows, these are the candidates that we are going to use, you know, this protocol, and we are implement the pain management program. So having the protocol, I think it is very important. Establish those guidelines, and then clearly state, you know, who are those animals that are going to receive the protocol, and how do we know that those are the animals. So here is the steps to identify, you know, severe cases of mastitis. So I just picked one of the journal articles where they kind of classify mastitis in different levels or grades, right? So level 1 is just once you are milking cows, this is just basically abnormal milk. It's just flake of, you know, of milk or clot coming out of the teeth, and then a moderate grade, you know, is a different level, and I'm going to explain now, kind of using a cartoon, how these, you know, 1, 2, and 3 different levels look from the inside of the cow. So level 2 is just abnormal milk. Either you can have flakes or blood, and also you have an abnormal udder. So the udder could be red, swollen, or hard, right? And so how we do with this? Which one of the cows get a treatment here, right? And then the more severe mastitis, that is basically the 3 things. So the milk is abnormal, the udder is abnormal, and the cows could be either have fever and dehydration, and also be sick, right? She's off feed with low milk production. And sometimes, you know, grade 2 and 3, they do all need treatments. But specific, you know, I'm going to focus on grade 3, those are the cows that have severe mastitis. So the cow is already sick. It's not only that the milk is abnormal, the cow is already sick. So here is just a schematic representation of how, and I just don't want to do a whole, we can have several webinars on mastitis, but just a very brief overview. So most of these bacteria will come from the environment, so the bacteria will gain access into the mammary tissue. This is just a representation of 1/4 out of the 4. So a cow has 4 teeth, so this is just only 1/4. They will get access through the teeth canal, and then will colonize all that, the epithelium inside the mammary tissue. So bacteria will go up and colonize. Once you get the clinical signs, so basically just the milk start changing the composition, then you see those flakes or those clots, or the cow might not show any sign, like really Dr. Sorge mentioned in her presentation, those are prey animals, and they may not show any sign. You just only see, right, that the milk is abnormal. So either change the color, it come out with flakes, so something is going on in the udder. The cow still may not show any signs at all, but I know, or I can predict that something is inside the mammary tissue. If the process continue, inflammation continue, and bacteria, you get more and more colonization of bacteria, and the inflammation and infection process continue, then you get this, what we call, the quarter, it became, swollen, it became red, and then you can just, palpate it. It's a hard tissue at palpation. You can just feel that one. And obviously, milk is going to come out abnormal. So here is when we have, a severe case. The cow here may have either this is a grade 2 or it's a grade 3, depending on the stage and the severity of the inflammation. Here, this is a cow that probably feels pain. And this is the classic cow with pain that just affect dry matter intake, and if you affect dry matter intake, so milk production is going to go down, either because of inflammation in the quarter, and also because cow may not be drinking or might not be eating. Same as perhaps what happened with humans. So if there is no treatment there or no intervention, so what happens is, those epithelial cells are going to start dying, so they just die out, and they don't produce any more milk. So perhaps for that lactation, you may not lose a portion of the quarter, and for that lactation, the cow may not be able to produce more milk. So this is a severe case of mastitis, and this is the one that perhaps requires, pain management. So what we do have as far as pain management, and here is, I think, is important that get on board the veterinarians, right? And these are, severe cases, and Dr. Sorge may share with you a few pictures about, and you can tell that some of the cows are dehydrated by just looking at the eyeball with those sunken eyes, right? So dehydration is so the cow has, it's a very cascade of events that the cow has to go through with this, and so you gotta first, restore, the cow has to be hydrated, so either you drench or you do saline solutions, IV. You can use flunixin meglumine. It is in the NOP list, and you can use those, and it is very important to use if those are in your protocols, that it has to be done IV, right? And every 24 hours for 3 days. The withdrawal, I think it is very important that you follow those protocols, and usually it's twice as much what we have in our conventional farms. So I think this information is the same as what Dr. Sorge provided to you. So 8 days for meat and 72 hours for milk. So this is what we have. You can use aspirin, and Dr. Sorge mentioned that one. And that aspirin is not FDA approved, but yet is in the National Organic Program list. And the problem is that Banamine is a little bit more effective as far as half-life, how long it stays in the system. So what are those any other than pain management. And I think this is a similar list that Dr. Sorge allowed. You have a number of vaccine, iodine-based TPs, aspirin, flunixin, melamine, xylazine, oxytocin. And when we have, and I perhaps share with you at the very end now, I think I do have the protocol. For these severe cases of mastitis, not only you may have to use some pain medication to make sure that the cow, you control pain, but you perhaps might be able also to take the advantage of using oxytocin just to make sure you remove as much milk as possible out of that affected quarter. So it is important. A number of these are prescription drugs, and they do require veterinarians. And I think it is an opportunity here to work with both, work with the veterinarians and the livestock certifiers. And I know a few people that calls all the time, veterinarians calling the livestock certifiers just to make sure whatever they use on the farm, it is allowed. And it's allowed under the National Organic Program, or if you use something that is not allowed because there is no other options, at least you identify that animal because that individual cow or calf might have to leave the farm. So I just want to mention about this. This is not on the National Organic Program, but this has been discussion about it. This is, and perhaps this might be, I don't know, it might be in the near future. It's something that it might be added to the NOP list. So meloxicam, just for this bad in calf, and here is, this has been announced by the American Association of Bovine Practitioners, the Animal Welfare Committee, back, I think they released it early in January or in December of 2014, and yet it is not approved by the FDA, but we are allowed to use this one. So in conventional farms we use it. And again, this is not yet listed under the National Organic Program, but it might be added later on. I don't know how is the process to add or remove this list. But since it has such a sensitive topic and issue, that perhaps this is something that worthwhile. It's good to be added in the list. And meloxicam has a lot of data and indicating how effective it is as a painkiller. So they do have a lot of backup information for this specific drug. So there is a number of animal health regulation specific. I just kind of select those that are, I think, most important, especially regarding the National Organic Program and the list of approved drugs that we can use on the farm, and also there is a list of food animal residues avoidance database. I think this is important. It's important that you have the protocols, and then you clearly establish those withdrawal period, either for milk and for meat. And then the USDA Food and Drug Administration. And there is one section there, one link that is just for animals and veterinarians. So, and they do provide a lot of information on specific requirements for the use of drugs, and which one are prohibited, which one we can use. Important also the veterinary client-patient relationship, as working together and developing these protocols, and also there are some other things regarding producer must not administer drugs in violation of the FDA guidance. And here I think it's important. This is a very important topic for the organic industry and those producer handling animals, and to have those clear established protocols, make sure we follow those protocols, and when those animals or those situations that require pain management, those are the tools, the drugs that we cover, and but as well as specific and severe case of mastitis, you might reach a point where you may have to use antibiotics, and that might be the only options that you have left. And that is how important it is in that decision-making process that veterinarians are involved. And that is clearly stated in those protocols. So you just develop those escape therapies that allow you to make sure that animal welfare is not a concern. So with that, and I will take any question that perhaps the audience may have. So I will go back to you, Eric, and they may have questions for me or questions for Dr. Sorge.